little bit about triage and getting the patient to the right care at the right place at the right time. Bart Schmitt, our father of pediatric triage, published a lot on this as its role in the care continuum 2 decades ago or more. What do you think's changed since Bart's original work?
It's really fascinating. I don't think a whole lot has changed other than, I guess, some of our behavior, right? I mean, both, I say our on the patient side, but also on the pediatrician side. So if you look at his data, 10 years ago, 90% of pediatricians that had a nurse triage center took calls, secondary triage, and would talk with patients, and patients would kind of utilize that. Over the last 10 years, it's less than 10% of pediatricians
Wow.
are taking calls for nurse triage. And you showed the studies, the data is pretty evident that retail clinics and urgent cares and the ER are picking up all that slack, and patients now are conditioned. I had a mom yesterday said, well, I would have called the pediatrician, but they'll tell me they can't do anything, go to the ER. So I just came to the ER. There's that. We're kind of training a little bit of that behavior in our patients. It's not all on them. We have to accept our kind of 50% of the challenge, but the opportunity is there. We know that nurse triage it's 80% pediatric calls. We also know that nurses, qualified nurses, can handle 50% of those calls, if not more. And a lot of those can be converted to next day office visits. So there's a real opportunity. And Bart kind of influenced me 5 years ago when I got into telemedicine. He's like, Mick, if you're going to do this, you have to do, video nurse triage, and we have to get physicians re-engaged in that second level triage.